Hey everyone, my name is Angel.
And my name is Zoe.
Today we're presenting our research project for CNUR 209. Contemporary nurses are part of a generation that configures the future of acute care units. However, many novice nurses are experiencing burnout within the first year of their practice. The significance of this problem contributes to the ongoing shortage of nurses. In 2023, the highest number of vacancies recorded in Canada was 28,335. Notably, the shortage of competent novice nurses has a detrimental effect on patient care and health outcomes. The objective of this paper is to explore the experiences of burnout within newly graduated nurses working in full-time acute care. Ultimately, our research question is, how do newly graduated nurses perceive the impact of full-time active bedside nursing and acute care on their experiences of burnout during their first year of practice? Investigating the contributing factors that lead to burnout among newly graduate nurses brings awareness to the need for conventional programs or policies that will further prepare them for professional practice.
For our methods, we utilize the Prisma flow diagram to guide the literature selection process. Studies were sourced from PubMed, Ovid, Wiley Library, and the Accumulated Index in Nursing and Allied Health Literature. Our inclusions criteria included acute care nursing experiences of 1 year or less after graduating and studies on new nursing graduates' burnout. Our exclusions criteria includes articles from China due to department rotation mandated by national syllabus, which limits generalizability. The 5 peer-reviewed articles referenced throughout the research include 2 quantitative studies, Cattarelli and Chang, 2 qualitative studies, Al-Harbi and Martin, and 1 systematic review, Narbona-Galvez. Cattarelli explores the causes of burnout in 43 new graduate nurses with a cross-sectional study design. Through a phenomenological study, Martin utilizes semi-structured interviews with 7 novice nurses to investigate the stages of professional acculturation. Al-Harbi and Chang probe into the probabilities of job satisfaction and occupational stress among 206 newly registered nurses in their first year of working. Lastly, Narbona Galvez conduct a systematic review of the diverse challenges novice nurses face in acute care units with 16 studies, 10 cross-sectional, 3 cohorts, 2 qualitative, and 1 systematic review.
For our results, one of our themes is professional acculturation, which is new graduate nurses needing to merge into the occupational culture within acute care units. Martin identifies two key components of this transition. The first one being the socialization, which refers to the depletion of initial excitement among new grads due to mental and physical exhaustion. One participant shared that they left after 3 months stating, quote unquote, it was hard mentally to be a new graduate, basically out of nursing school, to go into such an intensive environment without a lot of experience. Second being acculturation, which highlights the difference between nursing school and authentic bedside nursing, and emphasizes the irony of being trained in a caring environment but entering non-caring workplace settings for new graduate nurses. Narbona Galvez also stressed that professional expectations are a major source of stress, causing self-deprecation and anxiety. Implicit coercion during the transition period also contributes to declining mental health.
Our second theme in our results is burnout. New graduate nurses often leave acute care jobs within 1 year, contributing to the ongoing nursing shortage. In that article by Cattarelli, burnout was measured using the Copenhagen Burnout Inventory, with each answer measured on a Likert scale from 0 to 100, and scores greater than 50 indicate burnout. CBI includes 3 burnout classifications with results from 43 participants. Workload-related burnout with a mean score of 67.5. Findings show burnout is indicated in novice nurses with less than 1 year of practice. Building rapport with experienced nurses and implementing transitional programs help increase retention rates. This reflects that prioritizing mental health and providing supportive services encourages new graduate nurses to stay in acute care roles. The third theme in our result is workload. The systematic review of Norbana Galvez highlight workload as a key factor contributing to burnout in novice nurses. Bakker and Demarati Jobs Demand Resources Model was used to explore how emotional strain and job demands affect burnout. Within the first 12 months, new graduate nurses are more likely to leave, perpetuating the cycle of nursing shortages as the aging population exits and the younger generation quits. The study stresses the need for early interventions to support retention and reduce turnover, describing the transition as quote unquote a difficult process that brings mental and psychological pressures.
Lastly, transitional programs was a prominent theme in all of the reference studies. They say that transitional programs play a crucial role in promoting positive outcomes for newly graduated nurses in acute care settings. Alarbi used semi-structured interviews to explore this theme. One participant shared that their trainer, quote unquote, taught them in everything in all situations, how to deal with patients, how to finish their papers, and how to manage their time during work. This shows that early guidance helps organize time and workload. Chang conducted a descriptive, correlational, and longitudinal study with 3 points of inquiry. 68.2% of those in mentorship programs reported being satisfied in their acute care roles at 12 months. Across studies, transition programs consistently reduce stress and dissatisfaction, helping newly graduated nurses feel more prepared and supported in professional practice. For our limitations, our first one is validity concerns. Confounding variables are not discussed by Cattarelli or Chang, which threatens the internal validity. In the cross-sectional study by Cattarelli, demographic variables like different types of units were mentioned. However, stating that they were confounding variables are not acknowledged or controlled, which may have influenced the research outcomes. Descriptive statistics were also used by Cattarelli, which describes the substance of the data but doesn't examine the relationships between variables. Unlike Chang, who conducted a longitudinal study, Cattarelli only surveyed new graduate nurses once during their first year. In Chang, confounding variables were also not identified or controlled. Participants were recruited from the researcher's university, raising the risk of researcher bias. This bias was not discussed, and without controlling variables, it cannot be excluded. Overall, both studies failed to address confounding variables, undermining their reliability, validity, and credibility, which are critical aspects of quantitative research.
Qualitative study limitations. In the study by Martin, small sample size, only 7 participants, limits generalizability to the wider population of entry-level nurses. Conflict of interest is present, but participants were known to the researcher, increasing the risk of researcher bias. The study lacks reflexivity strategies, which makes the internal validity vulnerable. In the descriptive qualitative study by Al-Harbi, the lack of reflexivity makes it difficult to determine whether bias or other variables shape the research outcomes. Overall, the prominent flaw in both Martin and Al-Harbi is the failure to demonstrate reflexivity, which is crucial for mitigating bias in qualitative research.
For systemic review limitations, there's country variability, which is in roles, responsibilities, healthcare systems, and resources, making it difficult to establish objective comparisons.
Variability in workload. Workloads differ by units, affecting the generalizability of findings. A new nurse in the emergency department may face constant high stress. A nurse in a post-surgical unit may have a more predictable routine. Therefore, burnout levels vary depending on the unit. To improve generalizability in future research, define workload more clearly, include nurses from various units like ICU, MedSurg, ER, and more. Measure workload more precisely beyond just work hours, such as patient-to-nurse ratios and types of responsibility. Compare different hospital settings, like urban versus rural, large versus small hospitals. As for knowledge translation, the transition from nursing school to the practice setting is a challenging shift for new graduate nurses as they are entrusted with new sets of responsibilities. Over time, without proper management, leads to burnout. The outcomes taken from the articles read can be integrated into nursing by highlighting the importance of putting realistic interventions to prevent early burnout towards new graduate nurses. Without recognizing the early signs of burnout, the possibilities of clinical error and decrease of quality care increases. Furthermore, supportive colleagues in the practice setting aid in alleviating some stress novice nurses feel.
The clinical question of this research stems from us, nursing students, who are witnessing many new graduate nurses leave bedside due to the burnout. Synthesizing all articles, knowledge acquired consists of a strong emphasis on the need for transition programs to facilitate positive professional acculturation. The findings can be integrated into nursing practice by supporting policies for transition programs. Highlighting such policy insinuates that organization and workload management are the major stressors among novice nurses. As a result, a disorganized nurse affects the quality of patient care. Transitional programs involving seasoned nurses result in a natural relationship to develop between the novice nurses and their preceptors. With guidance from professionals, working through the difference in practice between nursing school and authentic bedside nursing is supported. More importantly, the mental health of rookie nurses is acknowledged, which will decrease the likelihood of burnout and employee attrition. And that concludes our poster presentation. Moving on to our next slide includes the questions that were sent by our instructor. We will read the answers out loud in order.
Okay, so for validity of burnout measurement, self-reported Likert scale questionnaires can affect the accuracy and validity of burnout assessments as the participants may understand the questions differently because they have their own experiences of burnout. Therefore, there is a variety of lenses on each question. However, if this method is utilized while novice nurses at work, emotional state bias may occur and be more reflective of current mood based on the shift rather than actual burnout.
Moving on to the question about impact of workload variability on burnout. The variability in workload across different hospitals units affects the generalizability of the findings because not all nurses experience workload in the same way. This was mentioned earlier in our poster as well. To make future research more accurate and increase generalizability, researchers should define workload more clearly. As stated earlier by Zoe, include nurses from different units, measure workload more precisely, compare different hospitals, and using mixed methods.
For our third question, influence of socialization and acculturation on burnout. As stated, the transition from nursing school to the practice setting is a challenging shift. The struggle to adapt lead novice nurses to mental and physical exhaustion. The responsibilities they are appointed to without proper guidance is what causes the burnout to occur. Professional acculturation vary across different types of acute care units based on the pace and intensity, as some departments may be more fast-paced while others may put patient care over time. Patient needs and team dynamics should also be accounted for, as not all departments are the same. The implications it has for designing tailored transitional programs is ensuring that the programs are qualified for different units.
For our fourth question, it talks about the role of transitional programs in reducing burnout. While transition programs are helpful for reducing burnout and increasing job satisfaction, there are some limitations to their long-term effectiveness. First one being a short-term focus. Many programs last only a few weeks. Once the program ends, novice nurses may still face ongoing stressors like staffing shortages, having heavy workloads, or lack of support. Second one being one-size-fits-all approach. Some programs are not tailored to the unique needs of different units or individual nurses, which can limit how helpful they are. To make transition programs more effective and sustainable, especially given systemic issues like nursing shortages and high patient acuity, there can be customized programs by units. So this means having training and support to match the specific challenges of each department, like ICU or ER. And second one being gathering long-term feedback. Regularly assessing how past participants are doing and use that data to improve the program over time.
Our last question is selection bias and sample representativeness. Small or narrow sample sizes increase the risk of selection bias, meaning that certain types of nurses are overrepresented while others are left out. This can lead to skewed results that don't represent the full range of challenges new nurses face in different acute care settings. To make future studies more generalizable, researchers should have a wider variety of settings, such as urban, rural, teaching hospitals, and community hospitals. Second is recruit nurses from different units. Third, report demographic information clearly, like age, gender, race or ethnicity, location, and previous healthcare experience. Fourth, use larger randomized samples to reduce bias and better reflect the population. And last but not least, collaborate across multiple hospitals or regions to include a more diverse pool of participants.
And that concludes our overall presentation for our research project for CNUR 219. Our reference page is on our poster as well.